So in this video, we're going to discuss about the various forms of refractive surgery and which option might be the best for you. So in 2024, there are various forms of laser refractive and lens-based refractive surgeries available so that you can be free of spectacle use. There's a lot of misinformation going around that the public has. A lot of people think, okay, if the power is very high, we can't do anything, we have to live with glasses. Others think that if the age is over 40, there's no option for them, they have to still wear glasses. So all of these are false. What I would like to put across is, there is an option for everybody present. Everybody can be totally glass-free and have good vision. But the procedure with which they achieve that will be different. Everybody has a little different power. Some are older, some are younger. Some have a high power, some have a thin cornea. So there are a lot of variations involved. In today's video, as of 2024, I'm going to tell you clearly on the various forms of refractive surgery what would be the best option for you. So I'm going to begin with category 1, like I mentioned. So category 1 is probably the most common category with which most patients walk into the clinic. These patients are between the age of 18 to 42. So as you know, you have to be at least the age of 18 for you to consider a laser refractive surgery. Younger than 18, not possible. Over the age of 18, and you have to have your power stable for at least 1 year. So this is the most common age group, age between 18 to 42, power less than -10, and a normal corneal thickness. For these patients, the best procedure of choice as of today is known as Smile Pro. So this is a laser-based procedure that works by reshaping the cornea. As you know, any laser to correct the power works by reshaping the cornea by removing some tissue from it. How much tissue to remove depends upon the person's power. It is -1, very less tissue to be removed. -9, -10, high amount of tissue to be removed. So the patient must have adequate corneal thickness for us to do the procedure. Usually patients do have the corneal thickness available for them. So the Smile Pro procedure, how it is different from the older LASIK forms of the laser correction is that it is more non-invasive, meaning in LASIK, we made a 24mm cut of the cornea, raise a flap and apply the laser. Whereas in Smile, the cut made is only 2mm and there's no flap present in the cornea. All of this translates to better advantage for the patient. So after doing the Smile Pro procedure, the next day itself, patient can return to near normal activities. They can go out to the sunlight, they can work, they can look at the phone, screen, laptop, they can do physical activities, gymming, sports, everything is allowed. So the recovery is very fast, quick. Procedure is minimally painful, very less time taken. It takes less than 10 minutes to perform. And patients return to normal lifestyle a day after the procedure. So for these reasons, we recommend the Smile Pro procedure for all patients falling in the category 1, as it is the most advanced procedure available today, which gives us the quickest recovery and best clarity of vision. So we now move on to category 2 of patients. So like I mentioned just now, this is the second category. These patients are between the ages of 18 to 42 and they either have a very high power, powers more than -10, or even if the power is less than -10, they might have a thin cornea. So in this combination of patients, the best choice would be to go for a lens-based procedure. We will not be recommending a laser-based procedure for these category 2 patients. Why is that so? As I mentioned earlier, any laser-based procedure makes us remove tissue from the cornea. For patients who have a high power or a thin cornea by nature, if we still go ahead and do a laser-based procedure, it will lead to complications in the future. They will get the power back and their vision will reduce. So to avoid this, we recommend the ICL procedure for these patients. ICL is a very advanced technology in which we customize a lens for a patient, meaning the patient's eyes measurements are taken in a very high detail. We look at the eye length, wide to wide, curvature, anterior chamber depth, etc. And we look at the power of the patient as well. Once we do that, the lens information is given to the lens company and they manufacture the lens from scratch. The manufacturing itself takes about 1 week, 10 days, and then we receive the lens. Once the lens is received, we can then call the patient in and have it implanted, and it takes about 10 minutes to perform. Again, this is very advanced technology. Once the lens is arrived and we have it in hand, that lens can only be used for that specific eye for that patient. It can never be used by anyone else in the world. So it's a truly customized procedure. The advantage of ICL is it can correct any power. It can be -1, -5, -10, -50, -20 also. Doesn't really matter. Any power can be corrected with ICL treatment. Second advantage is we don't touch the cornea. So patients who have a very thin cornea, on whom we can't do laser, we opt for ICL treatment and we implant the lens. A lot of patients have a lot of concerns about ICL. Oh, it's a lens-based option. It's a lens going inside the eye. Will it stay permanently there? Will it move? Is it more invasive? Is it more risky or more dangerous? ICL has now been here for 20 years. We've been doing it very consistently. The results are fabulous. ICL is, in other words, a true blessing for patients who can't get a laser done or who have a very thin cornea or a very high power with which LASIK is not possible. So ICL, there's nothing to worry about. It is a time-tested procedure, a very safe technology and efficient technology, and the best procedure as of 2024 for patients who have a very high power or a thin cornea which cannot be treated via the laser-based method. So now we will move on to the category 3 of patients. Category 3 are patients between the ages of 42 to 65. These patients may have a power of less than -10 in the normal cornea and no cataract. So what is different? What happens to us when we cross the age of 40? As we cross the age of 40, you will find that all work that occurs at the near distance, looking at the phone, laptop, mobile, newspaper reading, books, all of this will require you to wear a reading glass. This is called presbyopia. This occurs as we age naturally. The strength of the eye muscles keeps coming down, and we require a reading glass after the age of 40 to do all our work comfortably at the near distance. So just imagine that someone who's been wearing glasses all their life, and at the age of 40, they also develop presbyopia. They will have to wear glasses for distance and glasses for near as well. They may use a bifocal lens, which has both the powers in the glass, and they use a progressive lens. A lot of patients will not adapt that easily to this bifocals or progressives, and they find it very difficult to keep using glasses for all the activities. They might even have different pairs of glasses. They'll have one glass for distance, one glass for near, one glass for intermediate as well. So this can be very troublesome because these patients are in the productive working group. They'll have to go to the office, they'll have to use a glass for the computers, they'll have to drive, they'll use a glass for driving as well. So all of this can be a real hindrance in their lifestyle. And for these patients, if they want to be glass free, we offer them a customized treatment known as Presbyond laser blended vision. So what exactly does this treatment do? So this is a very novel technology that treats both the distance and the near power of all patients in this age group. What we do in this procedure, why is it called laser blended vision? So as you know, all of us are either right-handed or left-handed, which means we're either right-hand dominant or left-hand dominant. Similarly, with our eyes, we are either right eye dominant or left eye dominant. In this procedure, we do an elaborate testing to see which eye is the dominant eye for the patient. Following which, when we're doing the laser blended correction Presbyond, the dominant eye is treated to see distance very clearly. Non-dominant eye is treated to see the near very clearly. So after the procedure, the patient is using both their eyes for all their activities. Their distance will be clear, intermediate will be clear, and the near will also be clear, and they can be truly spectacle free and will never have to use glasses ever again. So how is the recovery after the procedure? The next day after the procedure, patients can see quite well. They'll be able to see at distance, far and near, everything. So there is an adaptation period. For the first 1 to 3 months, the patient will have to learn how to use both their eyes synchronously and adapt to the new vision. This is called the adaptation time. So in the first 1 to 3 months, for about 10% or 20% of activities, sometimes they might find driving a little hard to do, meaning they have a little bit of difficulty reading in some activities and sometimes throughout the day. So that they'll have to learn. They'll have to put up with it and just keep doing their activities as normal, and the brain will learn to adapt to the new vision. And at the end of 3 months, patients can start seeing very clearly without any difficulty. For some patients, for the first 3 months, if they have a lot of difficulty, we offer them a temporary glass. So this temporary glass can be used at only the activities they are having difficulty. If some patient is having some trouble for the first 1 month for driving, We'll ask them to use the glass only for driving for the first 1 month, and after 1 month they adapt, they don't have to use the glasses anymore. So this Presbyond laser treatment is a real blessing for patients in this age group, because before this treatment came around, we were not opting to do a laser for patients between the ages of 40 to 65, and we would deny them a laser. But now that this treatment is here, and it is proven to be effective, these patients can opt for this procedure to be totally free of spectacles for all their activities. So we will move on to the last category of patients. Over the age of 65, patients who have a cataract, or patients even younger than 65, they have cataract. So what exactly is the cataract? You should be knowing it by now if you watched our previous videos. So cataract is a clouding of the natural lens inside the eye. So if the lens inside the eye gets cloudy, it's called a cataract. So what do we do in a cataract? We remove the cloudy lens from inside the eye and we replace it with an artificial lens with good clarity. So in a standard cataract surgery, what we would do is, we would remove the cloudy lens from inside the eye and replace it with a lens known as a monofocal lens. Monofocal lens will give a patient good clarity for distance, but they will have to wear glasses for intermediate and near for reading as well. In a patient over the age of 65 who has a cataract and they want to be glass free, we offer them a premium cataract surgery with what is known as a multifocal or trifocal lens. Same cataract surgery, only difference is we replace the natural lens with an artificial lens which is of a high-end nature. This lens has to be a trifocal or a multifocal lens. So once we place this lens in their eye, they will have good range of vision. They will not have any use of glasses at all. They can see distance clearly, they can drive clearly, they can read the computer clearly, they can look at the phone clearly without any difficulty whatsoever. So yes, truly, even after the age of 65, if you do a premium cataract surgery with a trifocal or multifocal lens, these patients can be glass free. But again, there is a caveat here. Some patients with trifocal lenses, they have this effect known as a photic phenomena, where if they go out at night time when they're driving, then they look at any bright light, they can see rings around light. This is an unwanted effect that we see in some patients and they don't find it very tolerable. So before the cataract surgery, we ask our patients, do you do a lot of nighttime driving? Do you drive on the highways? If they say no, we go ahead and implant a trifocal lens for the cataract surgery, and patients are very happy. But if these patients are nighttime drivers, they do a lot of highway driving, we don't recommend a trifocal lens. We'll recommend what is known as a EDOF lens or extended depth of focus lens. If we implant these lenses inside their eye, they will have very good distance vision, very good intermediate vision, and good near vision. But sometimes the near vision might not be that clear. For 10% of the activities, they might have to wear a glass for reading. So that's the EDOF lenses. So this depends upon the patient's lifestyle and what they do on a day-to-day basis. We will decide which lens is the best for them and which lens will give them the best spectacle freedom for their lifestyle. So we've now come to the end of the video. So I think you should have understood by now that there is always an option for you. All patients across all ages, above the age of 18 that is, they can get a procedure done to be totally glass free and they can have clear vision without glasses. There is no one shoe fits all. Every procedure has its benefits. So one procedure can't be the only thing that we do for all our patients, because all our patients are different. They come with different ages, different powers, different eye measurements, corneal thickness, etc. Depending upon all of their parameters, including their lifestyle, we choose the best procedure for them to give them the best vision. So I hope this has given you a rough idea as to which procedure would be the best choice for you. If you do have any other questions, please do leave a comment in the comment box below. I will be happy to answer them for you.